Welcome to Skyscape's free webinar series. Today's webinar will focus on mobile point-of-care technology and nursing education, benefits and hurdles. I am Kristen Snowden-Smith from Skyscape, and I will be the moderator today. This webinar is being recorded, and the presentation and handouts will be available to you. We will email you this information in the coming days. Our speaker today is Dr. Renee McLeod. Renee is an educator, practicing nurse practitioner, and has consulted with many nursing programs and businesses over the years on how to implement technology into the nursing curriculum and bridge technology into practice. She has been an educator and a dean at many universities and resides in California. Renee has personally been utilizing technology in the classroom, clinical, and lab setting for over 20 years. She is currently the dean of a California campus of Arizona College and maintains an active practice at Mid-City Community Clinic, where her patients tell her what is really important in the field of healthcare based on their latest internet search. I will now hand the floor over to Dr. McLeod.
Good afternoon. Today we're going to cover a few things. I'd like to talk about the using technology in the educational setting, overcoming hurdles to adoption of mobile digital point-of-care technology, how you use mobile devices in the classroom, how you can use mobile devices in the clinical setting, and I'll do a demonstration of the Nursing Constellation Plus. I have been exploring the use of technology in nursing education since I wrote my first computer nursing education program in 1978 on a mainframe using key punch cards while getting my master's at UCSF. In the educational setting today, faculty continue to need to find ways to engage students, helping them access knowledge, keeping them curious enough to find the answers on their own, and to question what they know as knowledge and evidence-based practice, which constantly is changing. I heard a quote today that stated that knowledge is only gained by curiosity, and curiosity is fueled by persistence. We no longer can just teach the facts. Our job is to introduce students to the tools they need to be curious about so they can be successful in school and to be successful professional nurses, not just the day they graduate, but through their entire nursing career. Technology is that tool. Currently, we have web-based solutions and mobile apps and tools. Students need both these options, but today we're going to focus on why mobile technology and the ability to find answers or evidence in real time at the bedside, which we know is no longer at the bedside, but is at the community clinic and is in the home and is in the office and might be in your local Walmart where the latest clinic is. And why finding that evidence in real time is critical, and why you need to be using this technology in the classroom and in the clinical setting. So what are the benefits of using digital references? Well, the first is speed. Apps are faster than going out to the internet and using the Google search engine, which we all know students do every day, all the time. Everybody does that, and we want to use something fast. We also know that the source and accuracy of the information is important, so that the information that they're accessing, we know, is good evidence. The information is provided in the way that the student learns best and can be read, listened to audibly, or interacted with using a variety of games, graphics, and videos to keep the student involved. This really offers learning on the go and is really critical to the student today who has a very active, busy lifestyle and is trying to work school into jobs and family and everything else that they have to do. They really need to have these resources with them all the time. And what they have, we know, is their phone. So what are some of the institutional hurdles of digital adoption? Well, we have a list of stakeholders that are involved, as we all know, when we're making any kind of decision about the curriculum. And the first usually is your dean or the administration, your department chairs, including maybe the chair of your bachelor's program or your other programs, your curriculum committees, and other people. I have been giving the same presentation for many years. Unfortunately, in the last 13 years, I've seen very little change in the reason or excuses why nursing programs have been reluctant to adopt mobile technology into the curriculum. But the reality is, things have changed dramatically over the years. The one fact that has not changed is that faculty to continue to be the biggest hurdle. What has changed is access to the technology and the cost. Students have always been early adopters of technology. Today, every student has a phone with them constantly. They're using it to find answers to questions immediately and are very comfortable with this tool. What has also changed is that faculty have cell phones. They also use them constantly to access knowledge, as do the nurses in practice, nurse practitioners, and all other healthcare practitioners. So this is something that's critically important because we have a tool now that's accessible and that can access that information quickly. One of the other stakeholder hurdles might be your IT department. And it's very important that you let IT know that when you're bringing in a mobile application, even though it is a piece of hardware, the IT department does not have to be involved at all, because this is now a personal device and that person is going to be responsible for it. Students, we've already said, are already going to have these devices. They have them in their hands. They all own one. And so students are usually not the issue. In fact, if you haven't put these mobile applications as part of your curriculum, then you're going to have to deal with the information that they're getting off their phones anyway, because they are going to be using these devices, and we all know that. I want to address bookstores. Bookstores in the past, in my past, as I've gone to different universities where I have put this into the curriculum, have sometimes been an issue. What I found at my current university is that students don't really care about the bookstore anymore. They're going to go wherever they can find the cheapest option for a textbook. And so you may have to work with the bookstore. Certainly a company like Skyscape will work with the bookstore to put that in there, but realize that students often will go out on their own because it's less expensive to go directly to Amazon or to the company itself. And we'll talk a little bit about clinical sites as a stakeholder a little later on. We definitely want to be sure that we involve clinical sites whenever we're doing adoption of digital technology. All of these stakeholders have conflicting motivations as to why they may support or create a barrier for you when you're trying to adopt mobile technology into your curriculum. And cost used to be a very big factor, but really it's not a factor anymore. We're going to address this. Again, the students already have the hardware in their hand and they've already paid for that. Now we're just going to talk about the cost for the software, which is usually less than the cost of a textbook. So it's easy to address that. So what are some of the solutions to these ideas that we've just had? Well, we want to start by rethinking what you already do. We're going to use books and references that you already have in your curriculum that might already be a part of your syllabi, which makes it much easier to adopt this mobile technology, because you don't really have to do a big curriculum review usually, because you already have identified this textbook as a requirement for the curriculum. You can address faculty resistance by demonstrating the application and showing them how easy it is to use this. That basically we're providing them with textbooks in a new way to access, a very easy way to access and link between the data and the information. Students today, unlike me 40 years ago, when I sat down and read the textbook from cover to cover, they don't do that anymore. We all know that. They want to get snippets of information. They just want to go find the answer, and they want to find the easiest way to do that. And we're providing them with a platform where they can do that very easy. Again, these are references you already know, you're comfortable with, you know the source of the data, and that it's going to be kept up to date. That if they're in a 2-year program and that reference gets updated the next year, that their data is going to be completely up to date. And we're going to provide an integrated software solution as one of the suggestions here that'll allow you to link to your existing courses and use this integrated mobile-centric curriculum that Skyscape offers. So how do we integrate these mobile devices into the curriculum? So the first person is who's in charge of the curriculum. Usually that's your faculty, and you have a faculty curriculum committee that's usually working on this. Are you already in the process of a curriculum revision? If so, this makes it very easy to put in there. Also, who are your early adopter faculty? Who might be supportive of this? Implementing new technology into the curriculum today is like selecting a new textbook for a course. It should be a decision that is made once a year when curriculum is being reviewed and decisions are being made on changes that need to be made for courses. This is one of those decisions that should not be made on a course-by-course basis, but as a program decision. If you're already using many of the books in the Clinical Consternation Plus or some of the optional books that are available to you through Skyscape, then this makes the implementation very easy, a very easy decision. It's just a faster way to access this information. And again, I think it's important to let your IT department know that their support is not required for implementing mobile technology into the curriculum. Implementation works best if it's a top-down approach, and the faculty and the curriculum committee have the support of administration. But it can certainly be done from a bottom-up process where a faculty member decides they want to use it in one course and then brings it forward to the curriculum committee and it goes up that direction. It is my opinion, and I've been a dean and a faculty member for over almost 40 years, that in nursing education today, all schools should have a technology review committee. We know that technology is a part of all nursing education. We have very complex nursing clinical simulation labs that are absolutely full of technology. We're using web-based programs, we're using web-based sites, and we're also using mobile devices. And that technology, there's a great deal of technology that really should be reviewed annually. This committee can be a subcommittee of the curriculum committee, or it can stand on its own. It should review all technology requirements annually as part of the school's strategic plan. Then all decisions can be made in an informed manner. Often students will bring forth new ideas for software, and it's a good idea to have students review new software and hardware as part of a class assignment. And then you can have questions related to the cost benefit of the software, the hardware, the web-based programs that you're using as part of your course and clinical evaluations. This gives you data. I'm a data-driven person, and this data can be used to support that technology or to make changes to what it is that you're using. Students will not see the value in the purchase of any technology, software, hardware, web-based programs, big clinical programs that you're using, like for NCLEX review, like ATI or Kaplan, or any textbooks, if the faculty don't use this in the courses or in clinical. If that's not used, if they never have to actually use it as part of an assignment, and believe me, you have to do this, you have to assign it. You can't just give it to the students and expect somehow they'll just use it on their own, that they'll figure it out. You have to actually do it, and you have to role model it. If you don't do that, the students don't think there's value to it, and they will be on their evaluations tell you that why did they have to purchase this or use it. So this is really important that this is modeled by the faculty. To do that, you need to have time for the faculty to get together to discuss their issues on any new hardware and software. You need to provide a time when faculty can see and play with the different hardware and software that you're using. I have a faculty meeting once a year where all new hardware and software that's been brought forth during the year that a faculty's found, or a new website, and we bring that together. We have an opportunity during the faculty meeting for the faculty to actually play with it and to review it, or to talk to the company, or for the company to do a detailed demonstration so you can see how that might apply to your curriculum. And I think that having that faculty review and input and buy-in is critical to this success. So now that we've decided we're going to put it in the curriculum, how do we actually do that? So mobile devices in the curriculum actually work best when there's an integrated approach to the curriculum and to the courses, which is why I think it should be a program decision. It should be something that starts with your first course and goes throughout the curriculum. So you don't wait until that textbook is introduced in course number 6 in semester 3, but that textbook is available to them from the very beginning. So I think it's best if all technology that's required is part of orientation. This is when to implement. And there is use of that technology in every course, rather than a scattered approach where only one faculty and one course uses it. Students should be told when to purchase and have the technology available on their mobile devices, and that could be their phone, their iPad, a tablet. And it doesn't matter what kind of phone or tablet, all the software is usually available on any kind of device. So that used to be a big issue, and it's not anymore. I give this information out to students as a handout during orientation, and it's also in the student handbook. This includes all required apps and software. During orientation, I give students time to load their devices so that they actually sit in front of me and put their apps on their device and register them, because it's really important that each student register their own software. A handout on technology etiquette is also provided and put in the student handbook. And this is really important because the students actually sign that they've received their handbook and that they've read it. And that way I know that they've received information on etiquette, technology etiquette, and they also know the consequences. So just like other clinical requirements, this etiquette includes turning the device on airplane mode in the clinical setting, helping students understand that no pictures are allowed. We spend a lot of time going over appropriate use of social media, what you can and can't post on your Facebook page, and the consequences of a HIPAA violation. And I've had students post all kinds of stuff, pictures of themselves with patients in the clinical, during a delivery, during a surgery, that they took photos of and posted on their Facebook pages. Interestingly enough, I'm not going out checking every student's Facebook page, but the other students in the class actually usually tell on them. And the consequences for us in our program for any HIPAA violation is dismissal from the program. So it's very important that you go over this, in that when you're using mobile devices, particularly phones. And again, even if you are not adopting a mobile software in your program, you still need to address the use of phones in the clinical setting and the classroom, because the students have these. So this is important whether you implement this or not. It's also important for students and faculty to understand and know that they're responsible for their own insurance, their own hardware and software support, which is now available from all the companies. And that includes the web pages that you're using, or the websites that you're using, any other software that you're using from companies. You should provide with your students their tech support lines, or help them understand that they're responsible for getting their own technology support. That's again why IT department's not required. And that all students, again, register their own software and hardware. Other things that you can do include planning training meetings where all the faculty learn how to use the devices and start working with the programs that are loaded on their devices. All faculty. It's critically important that you have your part-time faculty involved and that you have all your part-time clinical faculty. You don't want students going out with a clinical faculty to a site and having the clinical faculty have no idea what the students are using, or that they can use their phones and the information that's on their phone. It's also important that the clinical sites know that their students are bringing their phones and that they're accessing information on their phones using this software. It's really important that everybody buys in and knows. That's critical to success. Students and faculty also need to know if there's any other optional or required equipment that they need to have, like a set of headphones, a keyboard, a special cover, or anything like that. I think it's a good idea to arrange for monthly brown bag luncheons where faculty can share what they've learned and new things and ideas that have come up, that because it comes out throughout the year. And if you're recording those meetings, then it's very easy to bring those into those annual faculty meetings where you're making those decisions on implementation. It's also important to encourage faculty to use their device and the software in their own clinical practice or when they have students with them in the clinical setting. In my last school, we provided iPads to all the nurse practitioner students as we used available software and apps for most of the courses, and especially physical assessment, pharmacology, and all of their clinical courses. The cost of the devices was included in the student course technology fee. Most of the apps were free or very low cost. We had the students purchase some of the software like the Nursing Constellation Plus or the Clinical Constellation for Skyscape as if it was a book, which it is. Since it was a required textbook and it was listed as a textbook on the syllabus, students were able to put the cost of this into their financial aid package because financial aid doesn't care and does not dictate if the book is hardcover, a digital ebook, new, used, or anything else. So it's very easy cost should not be an issue. I want to stress the importance of these steps for a successful adoption of any technology. You need to introduce all the software and demonstrate it again during orientation. Faculty and students need to know how to load the software, how to evaluate software, and how to update software and make sure that they're using the latest version because the data changes so fast. Facts and what is current and is the latest evidence changes as fast as you tell them that the words are out of your mouth. Be sure and continue to do this in each course, that you make sure that, again, remind the students what they can use in the course, the software that's available on their phone and how to use it. I have a whole sheet of recommended apps and websites that the students are required to have on their phones and to use, and they include other programs on time management, organization, how to use their calendar, how to sync their calendar, say, with the school's calendar, and statistical analysis programs for my graduate students. We recognize that students will have their own devices full of all of other software. Again, even if you don't do this, you have to recognize that students have phones and they're using them. Be sure that if students are using software that's not included in their requirements to find answers to questions, they must provide the evidence and the source and why that information is acceptable. I'm all about the evidence. And in today's world, there will always be many answers to any question. So decide how you're going to handle this information. I think it's great to make it a learning opportunity. I think that I've always allowed students to challenge the information or the answer to a test. And if they can provide me with the evidence and the source of the data, I'm willing to change to give them credit for their answer. The use of mobile technology is actually an excellent way to flip the classroom. Students should come prepared to class, and they will if they have this. They should be able to answer and defend their answers on the fly in real time, because that's what we're trying to teach them, that in the clinical, you have a situation that's occurring, your patient's given a new diagnosis, you need to find the answer right there. Classroom time should be treated as clinical time. They should be learning in the classroom exactly what happens in the real time. We shouldn't be having this big discrepancy between what we're teaching them and what's really happening in the real world. We're trying to bring that closer together, and we can do that by making sure our classroom is more geared to show students the way you really do critical thinking and find the evidence in the clinical setting. You can have students work in pairs, which they can change their pair in each class or with each case. I use case studies, surveys, quizzes. I have them access videos or digital images. They can access the library on their phone. We can talk about email. And I always discuss internet access and Wi-Fi access, which sometimes they have more of. They use references for homework or in-class question and answer. I think one of the things that faculty are often afraid of is that that students they have questions and that you don't know the answer. And when you're using mobile devices in the classroom, you can just turn around and say to them, okay, you have 5 minutes. Who can find the answer to that on their device first? And let the students find the answers to the questions that other students are bringing up. Students today learn as a herd. They have a herd mentality, and they learn in groups. And I think we want to be sure that we have them work together in groups. It's critical that we understand that this is how they learn today and support this process, while helping them understand that passing the NCLEX is still an individual process, and they can't bring in their support or knowledge tool into that test. I think you also have to address texting. Students are going to text in the classroom. That's how they actually share their knowledge. And I think you have to allow that. Again, that texting and that group learn is important. And we just have to realize that students today learn in a very different way than we learned ourselves or that we were taught. I'm giving you an example here, which I know probably is very hard to read, of one of my class clinical preparation tools that I use in class to help students prepare. I use these to have them practice accessing information, and I'm going to demo that in just a minute. You want to provide cases that include multiple patient assignments or a new assignment the day of clinical. Pre-licensure students no longer have the luxury of going into the clinical site like I did the night before and spending hours of time looking up my patient assignment and all the information about my patient. Patients get discharged too quickly. As soon as you make the assignment, the patient's discharged. And so you have to make another assignment on the fly. Students need to know how to quickly, as soon as they're given an assignment, prioritize care, check their medications, check the procedures, understand the nursing diagnosis, the nursing implications, and the actual or potential complications before providing care to their patients. They're also now seeing patients in settings like nursing homes, community clinics, developmental centers, hospice, or home health, and these sites require the ability to quickly access information so that they can care for their patients, and there's usually not a computer with an electronic medical record sitting there and a resource like UpToDate. Many of the schools that I've talked to say, well, our students don't need this. They can access UpToDate on the computer at the hospital. Well, I don't know how many of you people have used UpToDate. It's on my computer at my clinical site, and I can't use that in real time. It's great that it's there, and if I had time after work, I can go and check those questions, but it's too complicated. It's not easy to access that information, and it gives you more information than you need. I just want the answer. I don't want 20 explanations to it, and it's very challenging to use UpToDate. You just don't have time. The other thing is, in the hospital setting, it requires that the student has access to that computer and is taking up space where another nurse may need to be sitting. So it's not good. And on a lot of clinical settings and in home health, that resource is not going to be available. And students can't walk around with all their textbooks with them. So I think it's important that we have these devices and that we can show them how to use them. It's also very important that your clinical faculty, especially your part-time faculty and your preceptors, understand and can use the same software tools as the students. A license for the software, or just CEU and a demonstration for your providers on the use of the software that you're using for your students in clinical, is a fantastic way to reward your preceptors both in the hospital and for pre-licensure and advanced practice students and preceptors. Issues in the clinical setting, just again to go over, work with your stakeholder facilities, and that's not just the hospitals, but all the settings where you have your students, to create appropriate and realistic technology policies. I always give them some sample policies. I worked a lot with our agencies on making sure they have realistic policies that are enforceable and that they're realistic. Remember that most of those nurses and all of their employees also have their phones with them 24 hours a day at work, in their pockets. Work to allow students and staff to use their mobile devices as ports to access the electronic medical record. This is something I've been fighting for quite a long time. We do have in my personal clinical setting a way for students to email their information to me, on the computer at work, I can then transport information into the electronic medical record. It's also, again, important to teach students how to keep information confidential regardless of the medium. And I cannot stress that enough. Students are just completely naive, is the only word I can use, about the use of their technology is so ubiquitous that they just do it. They don't think about what they're doing and the implications. And so you have to constantly remind them that when they're using their phones, that they can't just text stuff and type stuff, that none of that stuff is confidential, and how easy it is to make HIPAA violation. And if they've sat at any of the BRN meetings where nurses are being disciplined, they need to understand that there's really very big consequences for this. Now, I'd like to do a demonstration. Let's see if I can do a demonstration of the Nursing Constellation Plus. These are the programs that are in the Constellation Plus, and I'm going to use a few of them and demonstrate the smart search and smart linking, the bookmarks, and the history. If we can get this to work. Now, I'm sorry for my very busy computer that you're seeing. So this is inside the Skyscape app, and what you can see is all the books that I have. Now, this is more than is in the Clinical Constellation Plus, and that's because I also have the Skyscape Clinical Constellation. And as I'm a pediatric nurse practitioner, I have things like the 5-minute pediatric consult. These are all different textbooks that are available for purchase that I can link together in my Skyscape app. So this is a very useful app for me. I certainly couldn't go into my clinical setting and carry all these books. And when you think of where nurses are working, like in the school setting, when they're in hospice or they're home health and they're walking around, having access to reliable information that they can trust quickly on their phone is really a great tool that they're going to take with them on into practice. And I know we use a lot about ATI, and that is going to help them get through their boards, but that does not do anything for once they're out in practice. And we're giving them a tool that they're going to use. So the clinical preparation tool that I have is just one where Mr. C, this is the one that I had demoed, and you're going to get a whole set of these study guides that I use after the presentation. He's a 68-year-old African-American male who was admitted with a diagnosis of chronic renal failure. I have admitting labs, including a BUN of 85, a creatinine of 4.5, and home meds, including Lasix, 40 milligrams, TID, 730 insulin, and Vasotec 2.5 BID. And then I have a series of questions: the definition of the disease, possible causes, medical treatment, expected priority assessment findings, lab findings that might be available, medications, the priority nursing diagnosis, a planning client goal. Now, these clinical preparation tools are going to vary. So you're going to have maybe something very simple very early in their curriculum. You may want to do something very different. Say they're in their physical assessment course. You may actually want to focus on assessment of the client. If you're going to have their pharmacology course, then you may just have a whole bunch of these where they're using their drug guide, so they're really used to looking up information. Now I'm going to go out here to Davis disease and disorders. So if I was a student and I had just gotten this, I'd probably go in here first and just type in renal failure, because that's what it says he has. And if I don't know anything else, I'll do that. And renal failure comes up. Now I've got this looking pretty big because you can set the size of the font, and I like it pretty large. Also, I think it's a little easier for you to see. And you can see that what popped up was acute renal failure, acute renal injury. Now I would need to scroll down, and this may take a little while. I'm going to try to do it slow. I have to scroll down right now because I've got it up so large. But I can see that if I go down a little bit, it's going to take me to chronic renal disease or chronic kidney disease, and that's what I really want to look for. So I'm going to that. It quickly takes me to chronic renal disease. Now, if I don't want to have to scroll down, you can see up here at the top, there's a little box with an arrow on it. And when I click on that, it tells me the section so that in this book, I can jump to any of those sections. And right now, those are the sections of the book, and they're specific to kidney disease. So I'm not looking up everything else. I'm still looking only at kidney disease. And you can see, I can go in and find the causes of kidney disease, the definition of the disease. That was one of my questions that I had to look up, and the cause. Genetic considerations. I can go right in and find assessment. So if one of my questions was expected priority assessment findings, and they're right here. And then you can see at the bottom, the primary nursing diagnoses are there. So I can go straight out there to the primary nursing diagnosis, and I can also find that information. So you can see that it's quickly there. It's very easy to do. I also can go down to this little chevron, this little blue marker down at the bottom, and it brings me up a quick smart link tool. So the first one is the home page, which was the first page that I was at that had all the list of books. The second one is my little smart link. Now I can quickly go to any book. Now I'm still looking at kidney disease, but now I can go to the laboratory, Davis's Laboratory and Diagnostic Guide, and you can see it takes me within that book directly to the disease that I was already looking at and the labs that are appropriate to that disease. And you can see the BUN is right there, and I can go into that detail. I can go into the amount of detail that that textbook has. Now, if you want more detail, you have to use a different textbook. So again, what information you're going to link to and find is what is only in that book already. Now, I can also get on here and I can link to, if I'm going to go, I can link to the drug guide. I'm still looking for kidney disease, and now I can see, I can go into the antihypertensives, I can look at creatinine clearance, I can look at the drug guide related to, again, kidney disease. It's very critical. The next one is this little stack set of books. This gives me my history. So the other way that you can, if you're going through a search and you've searched and you don't know where you've gone and you want to quickly go back to anything that you've been doing as a search, you can just go here and directly click on it, and it'll take you directly back to that topic where you were. It's also a place where you can add a bookmark. And actually, that's the next thing. This little book, the little green one, is a little book, and this is the list of your bookmarks. And you can see here that in the lab book, for me, I just want to quickly be able to look at what are the normal labs. Then I don't have to do too much. So I've bookmarked this table, which was in the lab book, the normal values of common lab test. So now I can just quickly use this, and I can use this for other assignments very easily. So you can quickly go out and find what you need. The next one is an information. This tells you the information about the book. This is really good for the students so they can quickly go out and get their source information for their APA citation, if they're using this information in a homework assignment or in a paper that they're writing for you, they can quickly do their APA citation. So I think that's really important to show students that they can do that. The last one is just like settings, and it can change your font size and what you're doing. I want to show you one other thing. Try not to go too fast. I'm not sure how quickly it resolves on the site. You can go to your home setting, and this is, again, all my books. And I can put in, and I'll put in kidney disease. And what it's going to give me when I put in kidney disease in the search there is a list of, in all the textbooks that I have on my device, it'll tell me which ones have information on kidney disease, and I can link directly to them. So it's just another way to do a smart search through a number of books. So if I need 3 pieces of evidence or 3 citations about a particular topic, I can go in here and now and find 3 books that have 3 citations on kidney disease or on the topic for my paper that I need. So it's quick and easy for the student to quickly look up information and jump from textbook to textbook, and without having to look through this. So you can see easily what a time saver this is. And to have this on your phone where you're sitting there in real time is just amazing. I look up stuff every day in my clinical setting, using this information. So that's just a little demonstration of the Nursing Constellation Plus, telling you about bookmarks and histories and what you need to do. I'd like to take a minute to just wrap up here and let you know that today we've discussed overcoming hurdles to adoption of mobile digital point of care technology, and I hope helped you understand what mobile point of care technology is, how to use mobile devices like your phone in the classroom, and I guess more than anything else, helping you understand that phones are a part of every student's life. They're in your classroom, and we might as well use them as a resource. They're also going to be used in the clinical setting, so let's talk about how we can put resources on that device that's with them every day in the clinical setting and how you can use that to enhance your nursing curriculum. And we've ended by doing a demonstration of the Nursing Constellation Plus.
Thank you, Renee. Now we'd like to open up the floor to question and answers. You can type your question in the chat window, and we will get to as many of the questions as we can, and any questions we don't get to, we will answer via email. So those who are out there, go ahead and type in the chat window if you have a question. Renee, I have one question from faculty here. What would you suggest, or when would you suggest is the best time for students to start using these tools in their nursing studies? Like what class or?
Again, I think that our tendency in a nursing curriculum is to introduce their textbooks course by course as they go along. I think what I found is that when you really look at your entire curriculum and your program, if you can give them those resources from their very first class, even when they're in their basic first skills class, their very first class in the course, having access to this information is great. They have access to 4 or 5 textbooks that they're going to use, and of course it makes their textbooks feel very valuable when they're using them for 8 or 9 courses and not just for one course. They feel like they're getting a lot more bang for the buck. So you start them from the very beginning, and you actually go over that in their orientation and use it from their very first course on. You just use the assignments differently because as you start working with the textbooks in this manner, you can see that you can scale up the information that they're looking for, but they can start it right away. Students also, when they're doing that in that very first class, they feel like, yes, I'm becoming a nurse, and they're very excited about it.
Okay. Another question is, how you mentioned that faculty sometimes can be the biggest hurdle. How have you dealt with, or how would you recommend dealing with, if you have a divided faculty as far as using the resources? I know you mentioned that, using the resources across all of your classes is the best way to go about it, and faculty actually demonstrating use will get the students to actually use the device. But do you have any suggestions?
I think that, again, faculty own curriculum, and so it's important to get everybody's buy-in. And the first thing I think is really to see who your early adopters, who are the supporters of this, and have them help get their colleagues on board with anything that you're doing. And all your faculty may say, oh yeah, that's fine, I'll put it in my course, but then you find that they're not really using it in the course. So having again, those brown bag luncheons where maybe you work on group assignments and then demonstrate for the whole group how the faculty and the students can find that information on their devices. The students figure this out really quickly. Once you show them how to use this and you give them these tools, they use them quickly. It's the faculty that are a little slower, and yet it's important that the faculty get this, understand how to make assignments and how to scale those assignments throughout the curriculum. Then if there's one course where a faculty member doesn't use it, it's not as big a deal, because the students will, if they're using it almost all their classes, they'll see the value to this, and they'll continue to use it afterwards. We actually, on our alumni survey, we ask them if they're still using these tools out in practice. And so I think that kind of data is really important.
Okay. And I will ask one, I think that's it for questions that we have today. Do you have any final, oh, hello?
Yeah, I'm here.
You're good.
If we don't have any other questions, one school that I talked to, I just want to address, said, well, we're not going to put this in our curriculum because they already are spending so much money on all these other things that we have that they have to do. And programs like ATI that schools are so focused on for their pre-licensure students for passing their boards now take up a lot of time and information and money for the students. And I think that faculty need to realize that what we're talking about is really something that's very different, but that Skyscape has other tools also that are available for use that hopefully we'll talk about later. But this is really a different resource for the student and really uses stuff that they already have. So I think that it's easy to put this into the curriculum, and it's very useful. And I use this for all of my graduate students right up through my doctoral students. So it's these resources on their phone are available for your pre-licensure all the way through your nurse practitioner students and all the way up to the doctoral students. So just wanted to say how important this is.
Well, thank you for sharing that, and thank you for your time today. Just the final slide, if you want to move it ahead for me, Renee.
Yeah, that's right. Oops.
Oh, alrighty there. Very good. Excellent. Well, I want to thank everyone for attending our webinar. If you have any questions or want more information on Skyscape Solutions, you may email sales@skyscape.com. The references used in this webinar were the Nursing Constellation Plus. To learn more about Skyscape offerings, which include the Skyscape Medical Library, our Skills Hub app, or our NCLEX test prep apps, please visit www.skyscape.com/education. This webinar will be available on demand early next week at the skyscape.com/nursingwebinars2018. And if you have any questions that come to mind, if you review this later, go ahead and email us at webinar@skyscape.com. Thank you, and have a great evening.